We all know that access to healthcare is plagued by inequalities, and this is especially true when it comes to lung disease. But there are many ways this issue is being addressed by respiratory specialists. For example, deaths from smoking can be reduced if people have access to tobacco dependency services. Asthma care can be greatly improved by the provision of accessible communications, such as multilingual educational tools. Here's more from our team in Yorkshire.
We're going to do however many minutes, and we're doing level 1 to 2. Did you turn it up? You didn't, did you? We're up to 2. Can you feel resistance coming there?
Yeah.
In this gym, nobody's trying to set the treadmill to the max or lift the heaviest weights. Everyone here has respiratory problems.
I wouldn't go to a normal gym because I feel embarrassed by it, the fact that I've got super fit people around me and I'm struggling to breathe, so I'd feel conscious that they were all staring at me.
This rehabilitation gym is part of an NHS centre called the Breathing Space, purpose-built in a suburb of Rotherham, a town with a history of heavy industry.
I was born being a smoker. From the day my mother got pregnant, I was smoking. The pollution in from where I lived. Steelworks, fabrication shops, it was all over.
Poor environment, poor housing, employment prospects and low incomes can all contribute to respiratory illness. When it comes to those inequalities, the statistics make for pretty grim reading. A report by Asthma and Lung UK found that those living in the poorest communities were twice as likely to develop a lung condition and 7 times more likely to die from it.
Many of our patients have an expectation that they perhaps will get to 50 or 55 and will have lived a good life. And we're aiming to give years of life and also life to those years so that people can enjoy better health for longer.
Elsie was a smoker but gave up overnight after a test revealed she had very high levels of carbon monoxide. Today she's back to see if kicking the habit has worked.
Keep holding that breath as long as you can. Pop the tube into your mouth and gently, gently, fully, right out. That's wonderful. Okay. And your carbon monoxide level is an absolutely wonderful...
Oh, Jackie, I'm sorry. Oh, that's fantastic. It was 26.
Stopping smoking is one of the most vital things that you can do.
As well as encouraging patients to quit, the centre has Tai Chi and yoga classes. The focus is on finding whatever approach works best for each patient.
Having models, having posters, having something tactile to use in your clinic can mean that the patient goes out with a better understanding of their anatomy and physiology than giving them a leaflet that they're probably not going to read.
Language and cultural barriers can also restrict access to healthcare. In Wakefield, consultant Dr. Llunios Jones was determined asthma information should be accessible to all.
We were very, very fortunate to be invited into community centres and mosques. We trained community champions. We used that cohort to really guide us and co-produce collaboratively a suite of videos that were culturally competent, not just translated, but very culturally sensitive, to be able to sort of be very authentic and accessible for everybody.
અસ્થમાના હુમલાને અટકાવે છે.
We don't have hard-to-reach populations, we have hard-to-reach services, and that narrative needs to change so we can redress the balance.
So the onus is on you, really?
Absolutely, absolutely.
The British Thoracic Society has welcomed efforts by UK nations to gather better inequality data so that it can be tackled more effectively. The BTS itself is committed to doing what it can.
It's obviously never going to be as quick as you'd like it to be, but by ensuring that health inequalities is part of a theme through everything we do, we can start that from now. We'd like to deliver a workforce that's more inclusive, more diverse, that helps represent our patient groups and can help us address the health inequalities as a consequence. And that's clearly a longer part of the plan.
For some at least, initiatives such as those in Rotherham are already getting results.
So having this here is just marvellous because I know everybody's in the same boat. Everybody's got the same struggles that I've got, so I feel really comfortable and and it's really doing me a lot of good. It really is.